Hello, this is Dr Burgos de la Obra, Lipoedema surgeon. I'm the chief surgeon of Lipe Medical, who is a group of surgeons totally devoted and dedicated to this medical condition. And I'm happy to be with you today here to solve some doubts that they have been asked and to speak more about lipedema treatment and what it implies, what we can expect, and different questions of different aspects.
Thank you. And can you just talk a little bit about why you chose to specialise in treatment for lipedema?
All right. Well, yes, so some years back when I started to first look into what lipedema was, there was no one in Spain fully devoted to the treatment of lipedema from the surgical point of view. In my case, the thing is that a relative, concretely my wife, she had this condition, and at first she was looking for answers, going from doctor to doctor, trying to get a diagnosis, and then we were receiving diagnosis of overweight, lymphedema, different diagnoses, and so I started to look up what could be and why she had so much pain, so less response to diet or exercise, and then I found that there was this condition. When I found this condition, I said, okay, let's have it treated. But then I realized that no one was treating this surgically properly or fully devoted to this surgery in Spain. So then I decided to fully jump into this kind of treatment, specialized surgically in this kind of medical condition. And after some years, I dared to have the operation on her. So it went well, fantastically well. And now I can say that I can maybe operate on the Queen of England. I will not tremble because it's really hard to operate on someone you love. So that's how it started. And then when we started, this was a very little known condition. Almost nobody knew about this. There was no such awareness about this condition. In the last years, this has grown exponentially, and now there's a lot of clinical guides about this. There's a lot of scientific articles about this. We've grown as a group. We are now 6 surgeons performing this kind of surgery. I know that some patients just want to have surgery with me, but it makes no sense to just focus in one person, as we are a team that works the same way with the same quality standards and obtaining the same results.
So for all of the UK patients who are maybe a little bit nervous about coming to Madrid for the surgery, what would you say that would help put their mind at rest?
All right. I think that to make a decision to have this kind of surgery, it should be a slow decision. It's never good to rush into someone. It's better to check their results, their experience, if they are treating many conditions, and lipedema is one of them, or if they are treating just lipedema, if they are specializing in a treatment like this. In our case, we perform our surgeries in a hospital, in a BUPA hospital, and in our case, we have 2 options of consultations. We have in-person consultation and online consultations with following a specific protocol for that, including a detailed questionnaire, 14 specific photographs, a 45 minutes consultation. And we need to know that sometimes the online consultation is not enough. In some cases, we need to recheck that in person. But if all the criteria are met, the symptoms are there, the disproportion is there, the pain is there, the lack of response is there, everything fits, it's very reasonable to do an online consultation. But we need to know that early stages or maybe multi-operated cases need an in-person assessment. If a patient expects to come with us, she should expect a lot of care. In our case, we pay a lot of attention to the whole process. It's not just operated and gone. It's that the preoperative part of it has to be very detailed. We need to be very attentive that the patient is doing the preoperative test, is wearing the proper compression. We need to solve their doubts throughout all the process. There are hundreds of doubts. Yeah. And also, it's super important that the post-operative attention and care is very close and very personal. That's, I think, what makes us a little bit different, that we know that as we only treat this condition, we know that the post-operative period is not just hard from the physical point of view, but also from the emotional point of view. So the patient need to feel that we are on the other side, and we take a lot of efforts and time to make them feel this way. So I think that's something that makes us a little bit different from the rest of the groups.
For patients in the UK, obviously it's very hard to get a diagnosis. So do you have to have a previous diagnosis to be able to have the consultation, or?
There's no need of previous diagnosis, and the reason for this is that most of the doctors, not only in UK but worldwide, they are not really aware of this condition, or they are confounded with overweight, obesity, lymphedema, just tired legs, etc. So it's not just they can get, it's difficult for them to get diagnosed, it's just that they get the wrong diagnosis. So that's why we don't ask for a previous diagnosis. Of course, if there's a previous diagnosis, it's more than fine, but sometimes we recheck that diagnosis because sometimes there's overdiagnosis of lipedema, and patients with very few criteria are labeled with lipedema and they really don't have it, right? So it's a good option to have a previous diagnosis, but there's no need for it.